What if the act of giving birth nearly ended the entire human species? No other animal on Earth has a birth canal this dangerous. The human birth canal isn't just narrow, it's physically twisted. A baby's skull has to rotate 90 degrees inside the mother just to get out. If that rotation fails, the mother dies. The baby dies. This happens to 12% of unassisted mothers even today. So how did our ancestors survive this for 3 million years? Without hospitals, without doctors, without anything? The answer changes everything you think you know about human evolution. It started 5 to 7 million years ago with a single evolutionary gamble. Our ancestors stood up, and walking upright on 2 legs changed the entire human skeleton. The pelvis had to completely restructure, becoming shorter, bowl-shaped, and narrower. A wider pelvis helps birth, but a narrower one helps us walk and run efficiently. Evolution was forced to make a deal, and that deal nearly killed us. Here's what makes human birth unlike any other animal on Earth. In primates, the birth canal is straight. The baby slides straight out, face forward. In humans, the entry plane and the exit plane are perpendicular to each other. The baby enters the canal sideways, facing the mother's hip. Then mid-canal, the baby must rotate 90 degrees. And then it exits facing away from the mother, completely backwards compared to all other primates. This is called the occiput anterior position, and it's the only safe way out. If the baby tries to come out any other way, it gets stuck completely. We know this thanks to one of the most famous fossils ever discovered. Her name was Lucy. She lived 3.2 million years ago. Lucy walked upright, but her brain was still tiny, about the size of a grapefruit. Her pelvis told scientists that bipedalism came first. Brain expansion came later. But then scientists found something that shattered their models. The Gona Pelvis, a female Homo erectus pelvis found in Ethiopia. It was 900,000 to 1.4 million years old, and it was significantly wider than scientists expected, big enough to birth a baby with a 315 cubic centimeter brain. This proved that female pelvic shape was evolving dynamically, adapting to bigger baby brains in real time. The earlier male-based models, built on the Turkana boy fossil, had gotten it completely wrong. Now here's where it gets mind-blowing. For decades, scientists thought human birth was triggered by the baby simply getting too big for the womb. But the real trigger has nothing to do with size. Birth is triggered when a mother hits her metabolic ceiling. Her body can only sustain 2.1 times its normal energy output. When the fetus's demands push past that ceiling, the placenta simply cannot keep up. So the body says, time's up. The baby has to come out now. This is called the EG hypothesis, energetics of gestation and growth. And it explains why human babies are born so underdeveloped, so helpless. But survival wasn't just about birth itself. It started months before. Ancient pregnant hominins relied on what scientists call maternal nutritional buffering. The placenta and the mother's fat stores created a protective bubble around the developing baby during food shortages. But this model had 2 critical weak points: folate and vitamin D. Near the equator, intense UV radiation from the sun destroyed folate in the mother's blood. Without enough folate, spina bifida, the baby's spine fails to close properly. Evolution's solution was ruthless and elegant: dark skin. Melanin in dark skin acted as a biological sunscreen, protecting folate from UV destruction. But here's the problem. When hominins migrated away from the equator, they got less sunlight. Less sunlight meant less vitamin D synthesis in the skin. And vitamin D deficiency caused rickets, which deformed the pelvis. A deformed pelvis meant birth was impossible. Death sentence for mother and child. So evolution did something remarkable. It selected for lighter skin in northern populations. Skin color was never about race. It was always about survival, about protecting the next generation. And there was one more secret weapon: fish. Ancient hominins living near coastlines and waterways ate massive amounts of shellfish and fish. These foods were packed with DHA, a fatty acid critical for fetal brain development. Without DHA, the explosion in human brain size simply could not have happened. Now let's get back to the birth itself, because this is where something extraordinary happened. Every other primate gives birth alone. A chimp can reach down and guide her own baby out because it faces her. Human babies exit facing the other way, away from the mother. If a human mother tries to guide the baby out herself, she risks pulling against the spine, causing permanent nerve damage. Humans literally cannot safely give birth alone. This forced the evolution of something that changed our species forever: obligate midwifery. Older, experienced female kin, grandmothers, aunts, sisters, became the world's first midwives. The most effective birth position? Upright, supported squatting, gravity plus pelvis alignment, plus community support. This was the ancient human delivery room. But this raises an even deeper question. What happened after the baby was born? Because human babies are the most helpless newborns in the entire animal kingdom. A newborn chimp is born with 40% of its adult brain volume already developed. A newborn human is born with only 26 to 30%. This isn't a flaw. It's a brilliant evolutionary loophole. The baby is born early, before the brain gets too big to fit through the birth canal. Then the brain does most of its growing outside the womb, shaped directly by the world. But this created a massive survival problem. Someone had to carry, protect, and feed this helpless baby for years. One mother alone could not do it. So humans evolved cooperative breeding, alloparenting. The whole tribe raised a child, grandmothers, fathers, older siblings, aunts, and uncles. Grandmothers were especially critical. Older females who were past menopause could stop having their own children and pour all their energy into helping raise their grandchildren. This is called the grandmother hypothesis, and it's one of the most powerful ideas in evolutionary biology because grandmothering allowed mothers to shorten the time between births from 5 years in chimps to 3 years in humans. More surviving babies meant faster population growth and faster evolution. Now, here's a fascinating contradiction. Even today, some forager societies like the Jew/Hoansi of the Kalahari hold an ideal of giving birth privately, alone. The woman goes off alone, gives birth, and returns to the group. But research shows that even in these cases, experienced helpers are often nearby, just out of sight. This shows us that cooperative birth was the evolutionary default, but human behavior is remarkably flexible. So let's zoom out and see what really happened. Bipedalism gave us upright walking, but it trapped the birth canal. Expanding brains made us smarter, but made birth more dangerous with every generation. Skin color evolved not for aesthetics, but as a molecular shield around the developing fetus. And the helplessness of our babies, what looked like a weakness, was actually the key to our cognitive dominance. Every piece of this puzzle, the twisted canal, the metabolic ceiling, the grandmother, the fish, the dark skin, was evolution engineering the perfect storm. Not to make birth easy, to make us. If your mind is buzzing right now, that's exactly where we want you. Subscribe to the Think Deep, where human psychology, brain science, and deep history collide. Drop your most mind-blowing question about human evolution in the comments. We read every single one.